going to be discussing a very interesting and important topic today, which is the prevalence of gonorrhea in our population. Gonorrhea is the second most reported STD in the United States, affecting about 600,000 people each year. Gonorrhea outbreaks are often associated with specific social settings or practices, and Texas is the highest ranking state for gonorrhea at the moment. So now we're going to take time to talk to Dr. Quinn about how gonorrhea is not only affecting our population, but how it's affecting males and females specifically.
Today we brought in two patients who would like to remain anonymous to share their experience with us. The first victim we're going to interview is a male victim who has experienced the signs and symptoms relevant to gonorrhea.
Yeah, so I was having a hard time urinating, and I started getting this creamy pus coming out of my penis. And I said, "Doc, what am I supposed to do? Doc, this is my life. What am I supposed to do, Doc?" And they said I had gonorrhea.
Okay, now that we saw a male victim, let's look at how gonorrhea affects female victims.
My boyfriend told me that he got tested for gonorrhea and it came out positive, so he told me to get tested for gonorrhea as well. So the doctor told me that I got tested positive for gonorrhea, even though I didn't have no symptoms. But I was lucky enough to catch it, because if it was unnoticed, I could have developed more serious complications.
So as you saw from our patients that we interviewed, it is not only good to practice periodically to get yourself tested for STDs, but it is also recommended that a patient return 3 to 6 months after a treatment of gonorrhea, or after they get infected with gonorrhea. According to a recent study, reinfections account for about half of all reported infections, and repeat infections have been linked to a higher risk of developing complications. In men, if left untreated, gonorrhea can eventually lead to epididymitis. However, in women, the complications tend to be more serious, especially because over half of female gonorrhea infections are asymptomatic. Women run the risk of developing pelvic inflammatory disease, or also known as PID, and complications during pregnancy. Complications in both men and women can cause infertility. In addition, gonorrhea increases the risk for acquiring HIV. So it is really important that we treat gonorrhea symptoms early and people get tested early.
So, Dr. Quinn, what measures can the public take to reduce the chances of becoming infected?
The most effective way of preventing a sexually transmitted infection is abstinence. If abstinence isn't an option, then a mutually monogamous relationship and proper and consistent condom use would be best.
I also read that gonorrhea is becoming resistant to antibiotics. For this reason, the public should take special precautions. Could you maybe elaborate more on the topic of antibiotic resistance?
The theory of gonorrhea started becoming prevalent in the late 1890s. Since then, this disease has become resistant to several drugs that were originally used, such as protogal, sulfonamides, and penicillin. In 1989, penicillin was replaced by fluoroquinolones, but in 1991, resistance to this drug was reported in Asia. During this time, alternative antibiotic use included sulfexamine and ceftriaxone. In 2001, however, gonorrhea once again became resistant to sulfexamine, with prevalence among men who are having sex with other men. Currently, sulfexamine resistance continues to spread globally, as well as resistance to ceftriaxone was identified in Kyoto, Japan. This is disheartening, as ceftriaxone is the first line of treatment used currently and is the last remaining option for treatment of gonorrhea in specific circumstances. The main point, however, is that gonorrhea is becoming an unstable STD, and there are very few treatment options now available.
So, Dr. Quinn, the real question is now, how can we let people know about this untreatable STD?
I advise every sexually active person to get tested for STDs and implement safe sex practices. It is also important to be aware that gonorrhea is now becoming untreatable. It is imperative that we spread awareness around communities and health practices so that we can hopefully minimize the spread of this disease. If you have been or are infected with gonorrhea, please report it to your healthcare provider. This will help with tracking the disease more carefully and hopefully determining the better disease prevention measures.
This is Margie Basurto reporting from News Channel 5, and I hope you will all now go to your healthcare provider to get tested for STDs. Thank you for listening and have a wonderful day.
Yeah, call it how I see you. wish I never met you. I wouldn't wanna be ya.